Bruce, you must have something really good too.
Of course I do. It's Bruce Danielson, and I guess I'm here to entertain you too.
I'd like to call this budget hearing of Tuesday, August 17th, 2021 to order. We jump right into it. Police, please.
Greetings, Council. Amongst the new directors, it looks like I was chosen to go first, just to kind of get it going. So we should have some good information for you today. But the mission of the Sioux Falls Police Department is to partner with the community to serve, protect, and promote quality of life. While this statement is simple, it touches every part of our organization and is the foundation of everything we do. The first and most important priority of the department is the protection of human life. Officers in this department are trained to see themselves first as a public servant, one that is prepared to place themselves into harm's way at a moment's notice. This and the protection of a citizen's property are fundamental pieces of the department's mission to promote a safe city with a strong quality of life. Officers understand that their primary roles are to enforce law, maintain order, prevent crime, and act as a community caretaker. What is sometimes overlooked by the outside is that our officers are supported by a high level of a dedicated and effective civilian staff. The crime lab, records section, and animal control team are all important parts of our team that are sometimes overlooked but provide a great public service and help us along the way. The public safety mission of our city takes the entire team working together as a cohesive unit to provide the best service to our community. One of the biggest challenges faced by the police department and the city in general is keeping up with the growth of our city. Maintaining the proper number of officers, managing response times, and making sure the department is meeting the public safety expectations are all important consideration. The city continues to grow at an average of 4,000 people per year. On this continued rate of growth, we could see 35 to 50,000 more residents over the next 10 years, a fact that is not lost on the police department. As population grows, our calls also continue to grow. Over the past years, we've seen a 4% increase in calls, and as we continue to grow along with the city, we propose 5 new positions for this year for the police department. Of those 5 positions, 3 are for patrol officers, the backbone of our department, providing service to the residents on a daily basis, answering those 911 calls and responding to a variety of needs. As the department continues to grow, our need for supervision also grows. One sergeant is also included in this request. It's appropriate that we grow our supervisor ranks and maintain an appropriate span of control for our department as we continue to grow. Also included is 1 animal control officer. Again, often overlooked by the general public as their work sometimes goes unseen, but the call for service volume for animal control we see goes up every year and an important staffing spot we need to fill. The previous year's budgets have set us up for success, showing incremental growth in our employees that we plan to maintain and grow. We don't want to be behind. We want to maintain that incremental growth so we're prepared for what comes ahead with strong, substantial, but responsible growth. And scaling from growth continues to prove that we have done in the past continues to prove dividends. As our building needs were assessed with the opening of the Southwest Reporter Workstation this year, we are already seeing the benefits of that as the relieve stress on the building and also effective response around our community. As we look ahead to future in the Southeast, opening a Southeast Reporter Workstation in 2025 and 2026. And with the implementation also of our sustained growth of hosting a law enforcement academy program here in town, which was made provisions for in previous budgets, we maintain the ability to be nimble and to quality train our employees at a rapid rate to respond to our growing needs that are unique to other agencies across the state. A big component of that is our help from our part-time employees who are retired officers who also serve a variety of other roles within the city. These officers often bring quality and expertise that we can use in both training and other services to the city. And included in this year's budget is a $1 an hour pay increase to show our appreciation and to keep their pay market competitive with other agencies. This is something that needs to be under constant evaluation to make sure we are taking care of our part-time employees and making sure that we are paying them their value and also expressing the value they serve to both the city and the public. Again, as you're well aware, it's often been discussed, our continuation of preparations continue with the Public Safety Training Center. And we are excited for what that'll bring for us in the future and the continued level of excellence and training for all public safety aspects within our community. Looking ahead, we also have our connections with different agencies that are important for our success. We have an increase in our funding for Metro Communications to help manage our continued growth as a community. Metro is a joint venture between the City of Sioux Falls and Minnehaha County, provides a vital link to the public safety system that has been pushed harder than ever before with the growth of our region. This increased funding is necessary to maintain the increased calls for service and the growth of the public safety workforces in our community. With the opening of a new PSAP and the Public Safety Center, this increase in funding should help them prepare for future growth ahead. As we work with the community, we also continue to make real impact through collaboration with our partner agencies that are out in the community. We have seen time and time again by partnering with community organizations, we can make a real difference in people's lives. Included in this year's budget is an increase in our funding to the Children's Inn. This strong community partner makes an impact every day, helping the most vulnerable in our community. I know as a patrol officer, the peace of mind I had when I was left with few things that I could do, the ability to refer people to the Children's Inn and agencies like that to get the help that can cause real change and really help them along their way. These type of collaborations between the public and private sector allow real impactful change that we can only achieve by cooperating together. We continue to make preparations and plans to ensure that our officers are equipped in this budget as well. Protection of our SWAT officers and the performance of their high-risk duties is of paramount importance. In 2022, we will be replacing their body armor and ballistic helmets, which is very typical of they have a 5-year life cycle of usability. This will be on an annual 5-year rotation to make sure we keep these vital pieces of equipment up to date and protecting the officers who are often performing these high-risk duties. In 2022, we will start a new 5-year contract to upgrade our Taser equipment, which has reached the end of its useful life. If you remember in 2015, when we first implemented our Taser program, it was a great success for our department as we provided officers with tools they needed on a day-to-day basis. This new contract will provide us with the necessary equipment for deployment, as well as support and training and maintenance for this valuable tool. This updated platform will provide enhanced performance and enhanced features that will be greatly appreciated by the officers. Additionally, in this upcoming budget, we have our usual operating expenses to include patrol vehicles, radio upgrades, and a new police service dog, amongst other expenses. However, looking at our budget, it is clear to see our biggest cost is that of our personnel, with 80% of our budget being spent on our people. It's truly our most important investment as we look at our workforce, numbering 321 officers and support personnel that truly make the difference day in and day out. It's important we give them the necessary equipment and tools, but also have the right people that utilize that equipment and tools and performance of their duties to the city. I thank you for your consideration of these budget items. It will play a huge role as we prepare our community for a better tomorrow. And again, the Council and Mayor's Office unwavering support for public safety does not go unnoticed, and I know moving forward we'll continue to make the necessary preparations and plans to ensure we maintain the great quality in life in Sioux Falls we have always enjoyed. I will entertain your questions at this time.
Councilor Kiley?
Thank you. Chief, well, first of all, welcome to your first budget presentation.
Yeah, this is a new one, so
Good job.
I don't have a prepared speech for this one, so we have to kind of work through the first budget presentation.
Job well done.
All right, perfect.
I'm curious, we've seen how we have kept up with personnel by population, per 10,000 population, X number of employees. If we saw that graph, how would that look with the police department? I see calls for service here.
Yeah, if we look at where we're at as far as our staffing measures, we've tried to incrementally grow, especially through the last 5 years, to keep up with that pace. What we're experiencing now is just filling the open positions we have. And the strategies we have in place, especially with that class of 15 officers we welcomed last month, another 6 to 7 officers we'll welcome next month, as well as hiring in November, we should be able to reach that growth that we need to be at. And with that authorized number, as we achieve that strength, I think we'll have a really good ability to evaluate where we're at staffing-wise and make additional either tweaks or asks in future budget presentations. As we've seen for the past couple of years with the hiring climate being very, very difficult, I think we now stand at the threshold of really having some great things in place where we can finally realize maybe the full staffing potential that we have.
Well, that's, well, thank you for that information, and just know that this council supports staffing needs in, especially in PD and in fire, and we're happy to help in any way that we can. I noticed that you mentioned the part-time employees, a lot of the retired officers who are filling very important roles. Are they counted in that when you do compare your needs in terms of population growth and calls for service?
Sure. We currently have 10 part-time employees consisting of retired officers that work with our department. And we're constantly finding new ways to utilize them. Most recently, we've seen their great value as far as our training academy, and from a training standpoint, just the luxury we have of having some of our finest officers stick around to help train our new recruits. And so we work them in, we look for new ways to implement them and see what's there. And I think we're just kind of getting on the threshold of what we can do with them and use them to really be beneficial for our department and our community.
Good. Yeah, I think the more we can use with them, the better off we all are. And they are generally filling roles that are kind of behind the scenes and somewhat out of the public eye.
Absolutely, and it allows our officers to be deployed on the street and in their intended role. And again, it doesn't hurt to have quite a few qualified former officers in different positions within the city.
Sure, great. Say, by the way, I was at a college with a bunch of college friends this last weekend, and some of them produced my sideburn pictures. I'll have to make those available to you.
Yeah, please, we could do a side-by-side comparison of yours and the side.
I even had hair in some of them.
Perfect.
Counselor Erickson?
Thank you. Just piggybacking off of Counselor Kiley, are we at full strength?
We are not.
So how many are we down?
I think at this point it was 14 with the recent retirements, and with that group of 15. We look at hiring 6 to 7 next month, and then another class. In my notes of probably in November, I think it was 11. We have to look at projected retirements along with Chief Burns' recent retirement, some other personnel changes.
And let's be honest, they don't all make it. You
Nope.
know, so we know that going into
Yeah.
that we hope they all do, but some just aren't cut out for the gig, and we want the brightest and best to make it through. So
Yeah, we will not compromise standards for numbers.
yeah,
And I think that's just something we have to look into. And we look at being fully staffed as a goal that we strive for, but understand that there are just hurdles along the way to getting to that point.
it's always a game of catch up, it seems like, you know, I mean, it's just right when you're fully staffed, you have 6 more retirements or whatever it might be. Did we get the COPS grant this year?
The COPS grant we got last year, which is fulfilling some of the officer positions, I don't believe there was a new COPS grant for
No.
this year.
Okay.
These are all city-funded positions.
Okay, and then one more question that I have. With COVID, we obviously didn't have the special events. Talk a little bit about the new strategy as far as what that looks like for the officers, if they will be getting overtime, or how that's been absorbed in the budget, because I know that was really a big topic just a couple years ago.
Yeah. Yes, as we looked at it, there was money earmarked within that budget, around $200,000 to cover events. We have really done a strong evaluation of our overtime budget for the past couple of years. It's been a bit of a unique budget situation, as we've had a lot of wage savings from unfilled positions, as well as other issues that have allowed us to fund it. But we still maintain that funding level of $200,000 for events, but also made some tweaks to our overtime budget, anticipating that we'll be more fully staffed this year and have less need for overtime to fill those street positions. Again, with we didn't see the recovery that we thought we'd see in events for 2021 as far as spending some of that overtime budgeted money. However, we look ahead to 2022 and don't want to make any adjustments to that, as I would predict, and I think many of you would predict, we'll see a return to normalcy in 2022.
I think so too. Well, thank you for your presentation. Well done.
Thank you.
Other counselors? Counselor Brecky?
Just a couple of questions. I haven't really had a chance to visit with you yet. Congratulations on your new position.
Thank you.
Just what is your position on body cams? Do you see that in our future? And if so, how far into the future?
For many years, the body cams have been a hot topic, and a lot of officers and in command staff and administration were strongly supportive of body cams. I think there were some people that were hesitant, but we found immediately with the implementation that we did early in this year, thankful to the council for making the arrangements that we needed to fulfill that project. it immediately has proven massive dividends. It's become a normal way of life for us. We just expect these body cams as part of the price of doing business. But for us, it overwhelmingly has proven to be a valuable asset. There is no substitute for being able to immediately look up these videos from both an evidentiary standpoint, but just from a citizen complaint standpoint and everywhere in between. These body cams, again, thankful for the council's commitment to complete that project because it's been an absolute wonderful addition to our staff, or to our personnel equipment. However, looking in the future, we understand that that's going to cause future costs down the road. It's a system that's expensive to maintain. I have some storage things. We produce a massive amount of high quality video. And so that'll be a project as we look forward in budgets. We make sure that we are addressing those needs to make sure we maintain the storage costs that we, or the storage capabilities that we need to store this massive amount of body cam video.
And then one other question, what are your thoughts on police certification? We've seen our fire department over the years, undertake that years ago and have received some extraordinary awards and I would say some benefits, to their department from that. Is the police department at a place in their history where they should be considering that and having those outside eyes look in, tightening up those policies? What are your thoughts on that?
Sure. If you do an analysis of a CALEA, which is you're referring to, and look at agencies around us that use the CALEA program, we've been constantly evaluating throughout the years, and Chief Burns provided me some information to kind of get up to speed on the CALEA topic. It's something that I'm doing my own research on. I've reached out to Rapid City and other agencies, and what I found is a lot of the CALEA services, and while we still need to evaluate fully and look at what's there and the cost of implementing accreditation, we're receiving a lot of the similar benefits from our current policy review, LLRMI, which reviews our policies on a biannual basis. And what we find many times in review of these policies is that we are maintaining industry best practices and standards. And through LLRMI, I'm able to vet that policy and look through that further. However, this is something that, again, I knew when I took the chief role would be coming up. So there's quite a bit of research and further reading going into this topic. But I find that when we look at our policies, we are compliant with industry best practices and standards, and that's why I believe our reputation as a police department is so high, because of that extra attention to detail. But be more than willing to talk to you with further detail.
I would like to visit with you about that sometime, but
Absolutely.
I do appreciate just, you're reviewing it afresh,
Yep.
in your new capacity, and I'd like to visit with you about this. So I'll
Absolutely.
follow up with you on that.
Yep.
Thank you.
Thank you.
Counselor Kiley?
I'll make it quick. As follow-up to Councilor Erickson's comments regarding whether we are at sufficient numbers within our force, you had mentioned will not compromise standards for quantity.
Correct.
Boy, if I ever heard something that was quote-worthy, it was that statement. I'll state it again, will not compromise standards for quantity. I mean, that is very indicative of the culture that we've established in the city, and I feel very confident that under your leadership, we're going to continue that. But again, just to emphasize what Councilor Erickson, the point Councilor Erickson and I were making, if there is the need in public safety for police and fire, we are here to ensure that you have the numbers, staff numbers that you need to ensure public safety, because there's nothing more important than our citizens to feel safe within their community. So anyway, thank you and good job.
Thank you.
Well, I'll just have a couple quick questions. I see you have over $1 million in your budget for patrol vehicles. So
Correct.
could you give me a quick rundown of how you're going to work that and how many that equates to?
Yeah, so to equip a patrol vehicle, it's roughly $54,000 for a patrol vehicle. And we add some equipment and some maintenance expenses on that. Our patrol vehicles typically will last between 100 and 120,000 miles, or sorry, 100 and 120,000 miles before they kind of reach the end of their life expectancy. And then we kind of look at it on a case-by-case basis to see if they're still serviceable or not, or what we can do with them moving forward. Vehicles are something that we put a lot of stress on because it just puts we put a lot of miles on these cars. There's no take-home cars. They run all 3 shifts and they work nonstop. And so having sat down with Captain Garden, looking at Assistant Chief Hoekstra, looking at our long-term expenditures for these vehicles, and Fleet has done a great job with us as far as looking at how we're going to cycle through these cars and go through different options. Again, We're looking at right now the hybrid model too, and what we found, the hybrid life expectancy is about the same as your conventional gasoline car. So in here, I guess I did have a note here, we put about 2.4 million miles per year in total on our cars. And so, again, we'll keep a close eye on that. It's one of the things we try to maintain and be responsible and have the right number of patrol vehicles. But again, we could have two get crashed into and have a variety break down and be in a car crunch. But we're pretty used to navigating those issues.
Okay, I appreciate that. Is there any other questions? Seeing none, thank you very much. You did great on your first presentation. Next time, I assume it won't be written out, and you'll just
No,
throw it
I'm
off
used to just kind of giving it from the hip there. But I thought I'd write this one out to make sure I got it.
You did great. You did great. All right, now the best department in the city will come up. Fire.
I certainly appreciate that. Thank you, Kurt. Good afternoon, counselors. It is certainly a pleasure to be here in front of you and making this presentation, this request for a budget on behalf of Sioux Falls Fire. I'd like to thank the entire finance team, Sean's team, especially Sam, our analyst, for helping with this budget request, and especially with this presentation. So I thank you for that. With that, Sioux Falls Fire is among the most prepared and engaged public servants, providing the best possible customer experience to all of our residents and visitors. It's really paramount that we're out there and we're providing that customer service and doing that, and it's really through a commitment to service. So we do this through a number of avenues, through a number of different divisions, and and paramount to that is the one that everyone is familiar with, and it is emergency response. So we are an all-hazard response team. The general public doesn't care what's on your truck. They care that when they call 911, somebody shows up. So we're continually evaluating what these calls for service are and what we need to do to be able to provide that service. We provide that under 4 main umbrellas right now with fire, EMS, USAR, and then hazmat. So fire, everyone's familiar with the traditional fire truck coming to serve them, and firefighters operating in their structural firefighting gear. But we also have additional capabilities in wildland. It takes special equipment, special gear, special training. One anecdote there is over the 4th of July weekend with the weather that we had this year, we had 42 calls for service that were grass fire related within the city. So it's important that we continue to evolve what that response is. Not everything takes a traditional fire truck. We also work within our partners, mutual aid partners. South Dakota Air National Guard is one in particular we train with to make sure that we have the capabilities in the response should we have aircraft emergencies or fires within our jurisdiction. Another major area of response for us is EMS. Roughly 50% of our call volume is related to EMS and EMS calls. It was 2020 was a very large year for us as fire rescue got into the service of ALS, mutual aid transport. 19 years ago when I was at the Cadet Academy, the union president came out and spoke to Sioux Falls Fire's dedication to get to an ALS service. I'm very proud that we got to that service last year and started providing that. Especially during a pandemic, it was paramount that as there began to be uncertainties with staffing levels, uncertainty with call volumes, that there is a mutual aid party within our city that's able to provide that backup service. So I'd like to share with you today that in the first 8.5 months of this year of 2021, Sioux Falls Fire responded to 13 mutual aid requests for ALS transport. So 13 is a pretty impressive number to me. It really speaks to the dedication of our private partner, PCMS, and their dedication to provide service. But also, it really speaks to that special niche that Sioux Falls Fire has to provide that mutual aid backup immediate service. So those 13 responses were truly incidents where we showed up, we transported people to a receiving facility, so there was a need there, and a majority of those needs were a high priority call. So it's a niche that we're really excited to provide, and I think it really speaks to the entire system's dedication. I could not be more proud to be in the partner in that EMS system. Whether you look at the health department and what they provide with oversight, our PSAP and Metro Communications, PCMS, PD, and the receiving facilities, it truly is our EMS service is second to none, and it's truly driven out of a dedication to serve. Next, I'd like to touch on our USAR program. That discipline is developed through structural collapse, confined space, rope, trench, water, and ice rescue. Those capabilities, and as well as search. Recently, we've upgraded some of our capabilities there through a partnership with the police department and their drone program. We're partnering with them so that we can have increased capabilities, as well as we've researched or looked at another need that we have there to supplement our surface water rescue program with a dive program that we're again partnering with Sioux Falls PD. So an important relationship, and working with Chief Toom, really excited with moving forward to this public safety training center. In both of our careers, we've never had a closer relationship with all of our public safety partners, and this new facility is only going to strengthen that bond and that relationship. So really exciting time there. I'd like to close out the all hazard response piece with the response to hazmat. That really speaks to our dedication to being able to detect, identify, and mitigate hazards to our public and to our other response areas in the avenues of a hazmat response. And that really kind of closes out, but it really speaks to our operations, and that's what I call kind of our reactionary arm. We go out, and if somebody needs help, we react to that. We're probably one of the few business models that we're looking to strive to do better and see how can we put ourselves out of business. So we're looking to do that through fire prevention, through community risk reduction, and how can we reduce the number of emergencies that we respond to. Every emergency that doesn't happen that we don't respond to is a benefit to our community. Our code enforcement does that through ensuring that the places that we report to work, our homes and our assembly, are safe for us to enter. We do that through our community risk division and what they do to research and find where are our gaps in our coverage, where can we respond better, and how can we get that information out. So 2020 was an interesting year, and how do we deliver that information out to the people. Very proud of that department and how they utilize and leverage technology to really reach out and give those risk reduction messages to at-risk populations and to schools and that and of such. So exciting opportunities there. And then additionally, we're evaluating what our response is through that risk reduction, and are we providing the highest level of care, and what more can we provide to our community there. And I'm going to share with you here in a couple of minutes a partnership that's pretty exciting to that extent. Another commitment to service through fire rescue is our emergency management. Emergency manager Regan Smith is an employee within Sioux Falls Fire Rescue. He is dedicated to the preparedness, response, and recovery through emergency management and emergency services. It's no secret through the floods, the tornadoes, the civil unrest, and the pandemic that preparedness is of utmost importance. It really speaks to where we're at today as a community, our level of preparedness and our ability to get through that pandemic, get through the floods and tornadoes and rebuild quickly and get into recovery is why we're at the place we are today. And it's very important, and we continue to stress that and that preparedness, both internal and external, to the city members of Sioux Falls. Next, I'd like to touch on partnerships within Sioux Falls Fire. So I oftentimes say that the only thing that we have is community service. We don't give products, but we do in fact through our partnerships with American Red Cross, partnerships with Department of Social Services, in Sanford. We do provide smoke detectors to residents, to homeowners within our city, as well as we provide car seats to members that are in need. These are life-saving devices that we're more than excited to use our footprint, to use our manpower to make sure that we distribute and get those into the hands that need those the most. Last partnership I'd like to touch on today is a relatively new partnership with Avera at Home. Through our captain of community risk reduction, he's been identifying that some of our responses and lift assists are avenues where we go out and we respond. We use our emergency functions to provide a low level of emergency response to citizens that need help, but are we ultimately giving them the best service that we can? And through these conversations and through a partnership with Avera at Home, they've stood up a program called Enrich, where they're able to reach out to these people and get them truly the help they need. It's helpful to our people. We're servants at heart, and we want to do our best job. We want to do as much as possible for these people, and sometimes just lifting somebody up isn't enough, so they need more. Through this partnership, through this relationship, we're able to do that. We're able to get them the help they need. They're able to stay in their home, improve their quality of life, and additionally, it's a reduction in utilization of services that can be reserved for members that truly need that in an emergency situation. So really exciting partnership there. Next, I'd like to touch on our national accreditation and then our ISO rating. So Sioux Falls Fire is accredited through the Center for Public Safety and Excellence. We were accredited most recently in March of 2019. That is a process that they come on site every 5 years. They provide that accreditation. We're due again in 2024. It's a very extensive process where they come in and they measure, and they're based on a model of continuous improvement to evaluate what are you doing to evaluate risk, and are you providing that at the highest level of standards. So we do support continuing that process. And then additionally, our ISO rating through in the Insurance Services Office, we are rated presently at an ISO of 1. That is the lowest rating that is possible. They are on scene again this fall to evaluate. They go through and evaluate our resources of apparatus and equipment, station placement, station training, water supply and communications to make sure that we are spread out and have the appropriate resources to respond to fires. It is our expectation and our goal that we will maintain an ISO 1 rating into the future. With that, I'd like to speak to and share with you some of the major impacts of this budget request to the council here. We are scaling for growth. One of those issues with scaling for growth is we're looking at a request for 2 additional part-time employees. 2021 was a large year for Sioux Falls Fire. We added a fire station number 12. With that comes 15 FTEs and is a really large lift for the city and for us. So we know that that's a major request. And with that, and especially with the footprint of what that gives us in the city, it really kind of opened our eyes once again that we have a really large footprint. We have a lot of places to get. We have a ton of equipment moving around. How can we better utilize our people? These requests are really based in an effort to keep people working in their function and their core mission. So we're hardworking Midwesterners. If something needs to move, we just get up and do it. Well, are we utilizing that person the most efficient? We have training officers that need to be training. We have battalion chiefs that need to be in there leading their people, not providing these support functions. So this is an effort to really utilize the FTEs that we have to make sure that we're being efficient in those models. Another area of scaling for growth requests we have this year is in our PPE. 2020 really put PPE on the forefront of everyone's mind. Our protection equipment has been at the forefront of firefighting since the inception of firefighting. Really no different for Sioux Falls Fire. We do really good. We provide great equipment for our people. Now we need to make sure that we have that stock that we're able to get them in clean gear. So as we continue to evaluate what does it mean to provide the most safe work environment, there's no secret that there's carcinogens that are present in the products of combustion whenever we exposed. So we're continually working through how can we efficiently and automatically provide people into a second set of gear, into clean gear, so that they can get back to work and provide that core function that they're doing. So this request with PPE in your book, you'll see that it does show as a request from the 2021 budget. There was a spike in 2021 to support Fire Station 12. This would be an increase above where our level was at 2020 to support that additional PPE into the future. Additionally, we have a request for capital in the dive program. I spoke to our collaboration, our partnership, as we continue to work through and look at what are the risks, what are the hazards within our community. Dive rescue is one of those pieces that we saw a gap in our coverage. We identified and we saw that it was a great opportunity again for PD and fire to work together between their park resource officers and our officers to provide that. So it's collaboration where we will support that dive rescue equipment in 2022 so that once our people are trained up, we're able to provide that response capability. Finally, on the scaling for growth, I'd like to touch on the future fire station investments. It's no secret that the city of Sioux Falls is growing really in all areas. So as we look at our response model, we need to make sure that we maintain travel coverage. We work through a model of it's both distribution as well as concentration. So even as we grow out into out into the growth district, we may have relatively low concentration, but we still have a duty to serve those individuals at a high level. So there's growth that we have in the northwest, southwest, east, and southeast. We're being very deliberate and very intentional to have conversations with all city departments, all members, to look at where that fire station needs to be. So we have not identified that location, but we are confident that there is a need there to continue our expansion and that request for that build in 2026. As we look at connecting people with community, I spoke briefly to the fact that our community risk reduction, they're working to continually get messages out to our population. We work very close with our CMC, with our communication marketing coordinator through the Innovation Tech Division, and we work with them. We look forward to, with this request, providing 3 digital signage boards so that we can put out safety message in collaboration with our public safety and health partners should we need to. The plan for that would be to put up a public safety message board at 41st and Marion Road, 37th in Minnesota, and 10th in Chicago. All 3 high traffic areas where we can get messages out when that's pertinent and important to our population. And lastly, I'd like to talk through investing in today for a better tomorrow. Facilities and repair maintenance We have a lot of facilities. We have 14 report-to-work locations. We have a lot of people. One thing that's maybe a little unique to fire is that our fire stations are our homes. We care very deeply about them, and we couldn't be more impressed working with the finance team and with their facilities team. They're doing a tremendous job looking at what do we need to do for a schedule to make sure that we're remodeling. We're keeping up with maintenance with these facilities to make sure that we have the funding to make that possible. So that is one of our requests in that facilities maintenance repair budget. And then additionally, a capital request for radios. Communication is important across all jobs, across all functions, none more so than in public safety. We need to ensure that our responders are able to reach out and make that communication when they need. This request in radios allows us to update our mobile cache to the latest in capabilities and technology so that when we're in difficult geographic areas, difficult buildings, we have the capability that we're able to reach out and communicate with our other responders as needed. With that, I'll yield the floor, and I would appreciate any questions or comments from the council.
Councilors, questions? Councilor Starr?
Yes, thank you, Chief. Great presentation. First of all, talk a little bit about the growth isn't just the coverage and the time, it's the new industries, I think, that are coming to town, different ways of, you know, you fight one type of fire with a different one, and the prevention that goes with it as part of the growth. Give me maybe some examples of how that's handled.
Paramount to those is our involvement with code enforcement and building services. You know, so we look some of the large structures that are coming in, the features that they're putting into those buildings. They're really doing a tremendous job to make them not only as fire resistive as possible, but they also work to put in those fire protection systems. The water supplies are adequate. The sprinkler systems are there designed to control those at the point of origin, as well as to provide us those internal plumbing systems so that when we get on scene, we can access and make aggressive entry into really large facilities. So code enforcement is paramount on those. But again, and then it can't be a replacement for that ultimate response. So we don't necessarily change our station location or our target timing for that. We still work off of a model that the national standard is that we're able to respond to 90% of incidents within 4 minutes. And that's what we model our response off of in our station placement. And then from there, we look at, okay, when we have special industries, you know, we have a Smithfield Fields at downtown, we identify that as a high hazard. Once we know that we have an incident there, we need to send additional units for response.
Thank you. The other thing that really got my attention, because in the 5 years that I've been here, 5 years ago, we had firefighters standing around at emergency situations and watching people and waiting, and we've come a long ways. And to be proud of that 13 calls for mutual aid where we're actually transporting, to go from a time where we wouldn't even start a line or barely do CPR, and we had our well-trained, probably the best trained, I would say, EMTs and paramedics, at least in the state, if not the region, have to stand and watch and wait. And we've come a long ways in those 5 years, and I'm proud of that, and I'm glad the department is doing that. I think not only the being proud of it, but our citizens who are happy to see that response and not watching firefighters stand when they're better trained than the people who are waiting for and have better skills and experiences. 13 is an awesome number, and it's a good start to being able to do that, to use the services that we train for and pay for. We spend millions of dollars keeping our paramedics and making sure everyone in your department is at least an EMT. To not use those services after we train for them, I'm just excited about that process.
It's incredible, the entire system and where we're at with growth there. I'll share with you also, so that mutual aid transport is one piece of it, and now this year we've taken that one step further. As we've brought more ALS paramedics online, we're now able to, we have them staffing locations that don't necessarily have one of those mutual aid transport. We've now built in the system with the partners between REMSA, Health Department, and Metro Communications, an ability that if we don't have an ambulance prepared and ready, we're still able to start a paramedic. And all of that has gone into a tremendous amount of research and data that they look at exactly what is the outcome that we've seen in these call types and what do we need there. There's several call types, like a diabetic emergency is one in particular, where they may not need to be transported, but they need an ALS intervention quickly. We're able to build that into the system now. And additionally, we saw a spike in that utilization. And as we bring that system in line, it's been really exciting to see like how we've answered that. We're able to provide that care. But additionally, another number there is that July was an incredibly month in the system for EMS. And with that, PCMS saw their largest day on record of 81 calls for service with that. And in that day, in the month of July, there was not a mutual aid request from Sioux Falls Fire or even a mutual aid request for a paramedic, which means that they're doing a tremendous job. They're at full staffing. They're doing a great job with recruiting and retention there. So they're meeting their needs, but it's incredible that we have that backup capability because kind of the part of the nature of public safety is that when it rains, it pours. A lot of those mutual aid transports we had, Sioux Falls Fire transported 2 at that same time period. So they had met their max criteria of 9, 2 more calls hit. And that's just kind of the nature of the beast. You could have an entire fleet of trucks sitting there half a day and all the trucks come in at one time. So we're really excited to be able to provide that surge capacity when it's absolutely needed.
Thank you.
Yep.
Councilor Kiley?
Thank you. Before I get into the points that I wanted to make, I just want to follow up a little bit with Councilor Starr comment. While there may be some services that fire personnel are able to provide now that they could not provide years ago because they didn't have the credentials and the training, I've never ever seen a firefighter just standing around at a scene, whether it's an accident or whether it's a fire. And whether or not that was Councilor Starr's intention, I would hope that it wasn't, but it was stated twice that they were just standing around. I've never ever seen that, and I greatly appreciate the services that they provide when they're called upon. Just wanted to go back and emphasize again staffing needs and stations, especially in a rapidly growing community such as ours, how closely tied they are to our response times. Again, providing protections to the citizens of Sioux Falls, and how all of that, what I've just talked about, is closely related to maintaining that national accreditation and the ISO rating of #1. Because if we don't keep up with our staffing, with the stations and the response times down, the ISO rating then is jeopardized. So it's very important that we continue to support you as we have in the past. And I like to think that this council remains committed to doing just that. And then lastly, you had mentioned it. This past year has been a very challenging year for everybody in public safety, police and fire, responding during a time of pandemic. And I commend your staff and the staff of the Sioux Falls PD for performing extremely well under even more difficult situations than what you normally can expect. And I guess that wasn't lastly. Good job on really your first budget presentation as well too. I believe this is your first, so excellent job. So thank you very much.
Thank you.
Councilor Brecky?
Just want to visit with you a little bit about the certification program.
Yes.
And, you know, how long have you been involved since the city started that? Were you around at its inception, or were you kind of a beneficiary of it when you came on board? We've done it for a while.
I joined the department in 2002. We were first accredited in 2003.
Okay.
I have been involved with the process in each of our areas of responsibility once you promote to a chief officer rank. So 7 years ago, roughly, I was promoted to battalion chief, and at that time, I started writing a portion of that. So we do typically have one individual in the senior staff that's dedicated to providing that update. There's an annual report that we complete to go through and evaluate our core areas. But then really each individual in the chief officer rank is responsible for their areas to write to and make sure that we're meeting on an annual basis.
You know, as an observer from the outside looking in, you know, I left the city in 2004, so, you know, 2003 is when you were working on it and going through it for the first time. And then just to watch how the department has progressed since then, I feel like there's been substantial benefits to the department for having engaged in that process. And I was involved a little bit with it in 2003, just the details, just reviewing and studying the details yourselves. I mean, because you had to fill out all those forms. Back then, it was not computers, so it was three-ring binders,
Yeah.
three-ring binders, in
A
order
lot
to
of
get certified.
attachments.
A lot of attachments. So I want, tell me, in your own opinion, what you think. Do you think it's been beneficial, and can you highlight some of the benefits that you think that doing it, over the years has helped the department, and, and in what ways has it helped it, do you think?
It certainly makes you make a deep dive into every single area of your organization. So a few of the areas that I was responsible to as a battalion chief was our policies and our human resources, and it makes you dig and dive into every one of those policies, not just necessarily at a fire department level, but through an entire city, through your funding levels, through your organization, through HR policies, through executive orders, really. So it does make you go through and do an incredibly deep dive into what those are to make sure that you have a continuity and you're able to continue to provide those services. I think it's like anything, as long as you are able to dedicate the time and the resources to it, I would support. I had a good conversation with both Chief Toom and Lieutenant Cook when they were looking at going through the process, because they knew that this was a discussion, and looking at, realistically, they're looking at this could be a potential FTE, and I would support that it does take a tremendous amount of time and effort. So our individual that we have that's assigned to that, it does take a tremendous amount of effort. So he does take and do that deep dive and challenge those members into what does it mean for our policies and our directives. So I can certainly appreciate the resource that it takes to complete it, but as long as you go through that process and you're required to meet those core objectives, it absolutely has improved us as a department.
And you're committed to it into the future because you see the ongoing benefit.
Yeah.
All right, thanks.
Councilor Erickson?
Thank you. Thanks for being in front of us. I know we haven't had a lot of contact since you've taken over, and so it's nice to see you here. Are you at full force? Can you talk a little bit about that? As far as are your stations full force? Are you hiring, or how is that looking for retirements? And
We are presently only 3 members short. One of those is support services that we have with the fire protection equipment technician. We're technically only short 2 in the firefighter rank right now. With that, we hired a class of 18 that started at the end of July, and it is quite an extensive process. It's 3 months until we get those on the floor. So we have a number of retirements coming up. We're anticipating that when they hit the floor, we're going to be at the 6 to 7 short range. So we have full expectation to hire another class come January, and that class will be anywhere in the range of 12 to 15. We presently have a list of applicants that had applied back last spring in 2020 and applied, that we do have enough people on that list that we anticipate to utilize that list to complete that class in January and then test again in spring of 22.
wow, it's crazy. It's a lot of planning to
Yeah,
plan for those, so you make sure. I always go back to, the basic function of government is when I call 911, I want fire or police to show up as fast as they can safely. And if you don't have people there, it just doesn't happen. And so, you really have to be planned out for that.
Absolutely. The forecasting is paramount. So for us to bring in, we brought in 15 at the beginning of this year, 18 in July, and another 15. So that's a tremendous amount of growth in our organization, quite a bit of turnover. And the one thing that I'd speak to is that forecasting really helps. So we don't reduce service just because we are at reduced staffing. So we have reduced people. We don't reduce service to our public. What it really does is it puts that burden and that workload on our current employees.
Right.
So they've done a tremendous job of filling those seats through this summer. It's been actually incredible. There's been at times that we've been 9 to 10 members short, and they've been able to step up and fill that, and it's awesome. But it's also no way to staff a fire department long term. So
Right.
that certainly has been a long road. We're looking forward to November when we get to graduate another 18 members, get those on the floor, reduce some of that burden, and then in May, June of 22 to be able to be at full staff and really be able to enjoy that.
Great, thank you. And my last comment to you is thank you for your fresh perspective. Keeping your staff operating as efficiently as possible. I know the comment standing around was made a couple of times, and let's be honest, I've needed your services before, and they're assessing the situation. And there's so much that goes into an on-call scene, and that perception just isn't a reality. It's just not. And so I appreciate you really taking a dive in and looking at how you can keep people as effective and as efficient operating and what makes sense in your department. Oftentimes we ask you guys in every department to do more with less. And so you guys have really gotten good at doing that. And but we also want to support you and make sure that you have the tools and your staff has the tools that you need to answer those calls as quickly as possible. So thank you for being here.
Thank you.
Other questions, comments? I've got just a few. Currently, there's a lot of wildland firefighting and large fires going on, certainly west of us. Are we currently sending troops out there? How are they compensated, and how do you recover the cost?
We presently do not have anybody. There's a very deliberate process through the state, through the Wildland Services, to sign up to send resources out there. We presently, through this year, we have not listed anyone, and that is really an aspect of where we're at with our staffing levels. Our paramount response and our priority is to cover the city of Sioux Falls. Anytime that we send people out of our jurisdiction, we have to backfill with those. That is handled through a contract that we have with the state, and we're able to provide coverage and pay for that backfill of the person that's here, additional with compensating them for the pay that they'd receive out there. And additionally, we receive funding for utilization of any equipment that we bring with us. So that's very spelled out in the contract that we have when we do send people out. Presently, we are not listed just as a area of where we're at for staffing levels presently.
Okay, thank you. Seeing no other questions, you did an outstanding job. Thank you very much.
Thank you.
Move on to the hot topic of the day, public health.
Greetings, Council. Charles Chima, Public Health Director. I'd like to start by really appreciating Director Pitcher's team for their incredible work supporting the health department and putting together a budget proposal for the year, particularly Sam, our business analyst, and Tim Conda as well for the incredible support through the years. Also, I'd like to appreciate the presence of my really wonderful support at the department, Alicia Ebles, our Assistant Public Health Director, and Amy Richardson, Public Health Finance and Information Officer, who have just been privileged and really honored to work with such an incredibly dedicated and passionate individuals. So today, really just to have the opportunity to, obviously it's been my first presentation as well. I guess today is the day for the newbies. And really want to appreciate that opportunity to stand on the shoulder of giants, I would say, because really to speak on behalf of the incredible work that has been done by my team over the past year. So you all know I'm only about a month plus on the job. So a lot of the credit goes to the wonderful team that we have in the health department and the ability to just be resilient and take us through the pandemic. As we all know, the year has really been a challenging one for the health department in particular. All of us as well, but really the burden has been a lot on the health department to really step up to help the city mount an effective COVID response. And I think it has also shown the importance of public health. So I'm sure, prior to the pandemic, probably a few people had any sense at all what we did as a department. But I think the pandemic has given us opportunity to show why it's important to put health, first, knowing that without health we have nothing. So I think really, and that has also shown in our budget, which we'll talk about soon, with increased federal interest in sponsoring public health and a lot of the funding we've been privileged to receive through APA. So with that kind of background, I'd like to kind of reflect, start by reflecting on what we do as a department. And oftentimes the question comes up, for example, why would we even provide healthcare services? Isn't that for the private market? And yes, being a free market society, we absolutely, believe in the role of the private sector in providing health services. But we also know that the private market has its blind spots, right? Not everyone is equitably and effectively served by the market. And that's kind of where, the city as the public entity steps in to see that every resident of Sioux Falls just has a fair shot at life, right? Have that fair chance at receiving primary health, basic medical and dental services. So that's kind of one of the key services we provide through Falls Community Health, is to see that every resident, irrespective of their ability to pay and what their position in life, just has a fair shot at receiving basic primary healthcare services. But also beyond that, we have a lot of responsibilities that kind of fall into the scope of what we do. Part of that is really protecting the environment and seeing that we have a healthy environment, whether it has to do with code enforcement, seeing that we have, clean and healthy neighborhoods, but also with, when we go to a restaurant, we want to have that confidence to know that, we're not going to get food poisoning or any upset from eating at any restaurant of our choice. So really licensing, supervising, whether it's restaurant, whether it's daycare, but doing that work to see that we just have a good quality of life and healthy and safe environment. Also, mitigating health threats. So think about our vector control program, for example. A few weeks we were here at the council to have an information about our vector control program. And that's really one of the critical services we provide to the community, being proactive in monitoring disease-causing vectors in our community and seeing that we have an effective both preventive and treatment programs to see that we control our mosquito populations to avoid those diseases that they can carry. And also, we do, part of the key ways that we do our job is really by forming partnerships, because there's only so much we can do as a single department by ourselves, but a lot of our effectiveness comes through our ability to work with partners, as we've shown, for example, in the last year, by being able to work with other partners to mount a unified response to COVID-19. And so that we're not having, each entity doing the best it can, but rather really having a central, one Sioux Falls framework approach to addressing the pandemic. But also, that also extends to, chronic diseases. So for example, the Live Well Sioux Falls program, where we, through some of it through state funding, we're able to proactively look at health behaviors and environmental conditions, whether it has to do with access to healthy food that ensures that people are able to have, whether it's the proper diet or an adequate amount of physical activity to prevent and to protect them from chronic diseases. So to really point out that partnerships is one of the key ways we're able to deliver on our mandate as a department. And at the center of what we do is to see that everyone in our city just has that fair shot at living the longest and healthiest life possible. And last year, like we said at the beginning, was really challenging, but we also were able to demonstrate a lot of resilience and ability to thrive, in challenging situations. We were able to provide a lot of testing services. I think this is important to mention because at some point early in the pandemic, it was really difficult to get test results. And that was a lot of challenge. Imagine the situation where somebody was exposed and they didn't know whether they had gotten COVID or not, and just being pulled away from the workforce, that would have affected critical services. So the department was able to step up and see, whether it was city employees, county employees, as well as the school district. They all relied on the health department to provide them a quick turnaround with the test so that we're able to quickly prioritize who needed to be isolated and who is able to continue working. And I think that was a very timely and important service that we're able to provide to the community. But also, as the pandemic has evolved, we've been lucky to receive very effective vaccines, and we've played a critical role in saying that not Falls community health patients, but as well as other community members. So we've done a lot of outreaches. We've partnered with other organizations to see that we have a better understanding of populations that still have low uptake of the vaccine, and we've continued to do advocacy around promoting just general awareness and education about the vaccine. So testing vaccines as well as bringing partners together to work to take a one city approach to addressing the pandemic. And part of the response to addressing the pandemic, we had a lot of lessons learned, one of which was that we could also identify other ways to deliver care. So for example, we piloted telehealth during the pandemic. And one of the things we know happened during the pandemic is that people were just generally afraid to go to any healthcare facility, right? Especially if you were not having respiratory symptoms. That fear of, for example, wellness visits. A lot of people postponed their wellness visits. Well, we found ways around it. One of the things we did was to provide dedicated wellness clinics in the morning hours. And that way, we were able to separate those that might be symptomatic from those who were just here to get their mammograms or other, wellness checks. And we're able to prioritize those populations and give them a dedicated time to see that and assure people that we can safely provide you your preventive services even during the pandemic. And that was really unique because many health services we know nationwide just closed down and essentially suspended other services so that they could focus on the pandemic. But we were able to kind of carry those two along, be able to continue to provide preventive services as well as have dedicated respiratory clinics to attend to COVID patients. We also piloted telehealth for mental health. We know that one of the things we saw during the pandemic was just a general increase in mental and behavioral health challenges, all over the country, not just in Sioux Falls. And so part of what we're able to do to see that people continue to receive this critical service during the pandemic was to move to using telehealth to deliver the services. And that went quite well. So we're actually looking at part of the lessons for the future is how can we build on that model to continue to provide services and meet patients where they are through telehealth. And so we think that's part of, looking at the pandemic came with these challenges, but we were able to think innovatively and pick up some important lessons from that response and build on that as we move into the future. Finally, we kind of want to reflect on, some of the themes for this year, which is really thinking about what does the next few years look like in the city, and how are we going to position ourselves so that we're ready to meet the health challenges that the future will bring. And part of how we're doing that, it's really investing and scaling for growth. So we, through funding from APA, we are able to build out capacity to provide services to the community. And one of the things we'll be doing the next 2 years through APA will be investing in mobile health services. We know that some of the vulnerable populations we serve, we just have to have that capacity to meet them where they are. It's not always possible for them to come to the building to receive timely services. And a good example is, at the Bishop Dudley House and, just the homeless population, which we are primarily responsible for meeting their health needs. When we're not able to do that, what end up happens is, have improper utilization of the health of the system. So you're having 911 calls for a situation that could have been provided in a primary healthcare setting. So part of how we want to break that cycle of inappropriately using the 911 system is to have mobile services where we have medically equipped vans. They're able to go out to the communities and meet some of the patients where they are and be able to provide timely services to avoid using more expensive services down the line. We also, having followed up with the last community health needs assessment and knowing that one of the priorities in the community was to address issues around navigating the health system with regards to behavioral health services. So all the partners working together saw the need for the link, which has launched really successfully, and just grateful for the funding through the state that has enabled us to support the link as a department. But also, lastly is infrastructure. Again, through APA, we're able to receive some funding to invest in a patient resource center. So one of the things we're looking to do in the next year will be to have, again, knowing the population we serve and knowing that they need a lot of support with regard to navigating the system and just increasing general health literacy and awareness of health services. So we'll be having some build-outs at the health department, at the clinic, to develop a patient resource center that allows us to centralize a lot of the services, a lot of support services that we provide to our patient population. And we look forward to that in many ways because it will just provide a one-stop shop for our patients who might be looking for information on, signing up for the health information exchange, for example, and other resources that we are able to provide to them. So we're really looking forward to those infrastructural investments in the next year. Lastly, really just to appreciate the council for your unwavering support and the mayor's office for always advocating for health and really seeing that we have the resources we need to meet the needs of the community. More than happy to take your questions. And thank you for saving the best for the last.
Good one.
Well, if nobody else does, I'm going to give you the opportunity. I noticed in here, you mentioned it about investing in healthcare infrastructure. In your budget, you're asking for a large increase in repair and maintenance from $71,000 to $571,000, a $500,000 increase or a 700% increase in that. Would you expand on that a little bit, which equipment you're actually going to put into place?
So, yes, a lot of this is routine, and my finance officer here probably give us a little bit of more background. But a lot of this is not new money. This is more about already existing. I've actually pulled a call up because some of this is just reclassification in terminologies in terms of how we we do our finances. And this is not a new funding we're asking from the city. Yeah, I can provide a bit more context.
Sure. Amy Richardson, Public Health Finance and Information Officer at Health. The $500,000 increase in there is the ARPA funding for the remodeling project that he mentioned about with the Patient Resource Center.
No,
So-
I was talking about repair and maintenance.
Yep, and that's where it's at. Yep, yep.
Thank you.
You're welcome.
Counselor Brecky?
Last week, we were questioning you about the $50,000 for the
Yes.
Augustana contract. I forgot to ask you, you know, that's to kind of diagnose the situation and figure out why people aren't getting vaccinations. Do you have appropriate funding to wage a PR campaign if you need to, assuming you need to, once you get those results? Because we did pass a supplemental ordinance amendment, which I brought for $100,000 to help educate the public about the vaccine when it first came out and to encourage people to do it. And I believe that money's already been spent. Do you have funds available for that, or is that, and is that a part of this budget, or is there any supplemental amendment or that we might do in order to make sure that you have the proper money to follow up with the, after you receive the information?
Yeah, that's a really important question. And so, yes, we still have about close to $30,000 left on the initial allocation for PR campaign. And we recently had a meeting to refine the strategies, to kind of see the impact we've been able to have with those funds and to see what populations we need to focus on right now, which we know are mostly young people less than 40. So we are doing a bit of a reallocation and moving away from more traditional billboards to social media, which is where we know a lot of the population we need to target with regards to vaccination right now, and are tend to use more social media for their source of information than looking at traditional billboards. So yes, we're doing a bit of reallocation on the existing funds. In terms of need for new funding, we already have revenue streams which we're able to tap into to continue to do messaging. So for example, we have a new line of funding that will be coming through the state, a good part of specifically for COVID response, and a good part of that is dedicated towards being able to do more community outreach and messaging. So we are confident that we have the money we need in the short term, and if there is need to allocate more money to PR messaging, we'll be more than happy to come back to the council and have a conversation about that.
Thank you. Then I just want to talk a minute about the Delta variant. And again, in this funding issue, I've thought it was important all along that we have an appropriate funding stream available as we go through this virus and continue to go through this virus. We need to be out in front of the funding so that, again, you can respond at your every turn. We need to bring the public along with us. The Delta variant, what's happening with it, and probably, you know, I'll probably ask our leadership at some point. I think we need really a briefing from you, separate from the budget hearings, on, you know, what's going on with the Delta variant and where we are in Sioux Falls and what planning we're doing, and you know, what you may need in the future. But you know, should we be thinking about, you know, what could happen with that, and is there going to be funding needed to educate the public on that, or is that all tied into just the need to vaccinate?
Yes, so again, really good comments and questions. So with the variants, a lot, you know, some of the dynamics of the pandemic has changed, and you know, around two things. One is really that understanding that the vaccine continues to work, and we're very happy to hear that. Looking at the data and looking at not just nationally but worldwide, is that the vaccine continues to do its primary job, which is keep people out of the hospital and keep people from dying from the disease. More than 97% of people that have been hospitalized in the U.S. this year has been among the unvaccinated. So we know strongly there is correlation between getting vaccine and staying out of the hospital, and that's what we want to see. So our primary approach really is to see that we believe strongly we can vaccinate our way out of this pandemic, and we're pushing very strongly for more vaccinations, and that's our primary focus. But also other mitigation strategies. So one of the things that has changed in the past few weeks is that the community transmission rate has gone up to a level now, based on the latest data, both Lincoln and Minnehaha counties and now have a high level of transmission. And that's part of why we need to begin to consider additional strategies like, you know, besides getting vaccinated, I think it's time for us to begin to consider as well, you know, individually make that decision. When is it appropriate to wear a mask based on the new CDC guidance that shows that when you're in a public indoor setting, if you are in a high transmission area, I think it's time to consider wearing a mask. Not necessarily because you as an individual might be vaccinated and you might be safe in terms of being able to stay away from the hospital. But it's been shown that the Delta variant more and more is able to cause breakthrough infections. So you could still be infected even if you're vaccinated, and you could potentially transmit that to someone that is unvaccinated. So that extra caution of putting on the mask, even if you're vaccinated, when you're in a public indoor setting, helps to reduce the transmission and just the chances that someone, say a child, for example, who is not eligible for the vaccine, is able to get that from you. So that's part of the strategies that, and you're absolutely right, we're more than happy to come to the council to have a conversation specifically around the Delta variant, but we're already working on that with our partners in regards to having a lot of advocacy meetings, working with the school district to see that they revise their policies to be in line with what we are seeing with the pandemic.
Thank you for that. I've been wondering about that whole issue of being able to carry the virus, while you're vaccinated, even though you're vaccinated, can you carry the virus? And just wondering where that was falling out, if it's true that happens.
Yes.
So that does change the circumstances and change the direction that we need to go in. Again, if there's funding issues with regard to that, I hope you know that you can come to the council knowing that this is an ongoing thing, and that we may need to make adjustments as we go through this next wave of, whatever this pandemic is going to bring.
Absolutely. Like you point out, it's an evolving situation. So we continue to monitor. And one of the things we've done is we put together a COVID task group in the health department so that we're able to keep on track with our day-to-day duties as a department, but also have a team that is on top of the data and on top of the evolving information and is able to continue to adjust our approaches to addressing the pandemic as we move on.
Thank you.
Other questions, councilors? Thank you very much. You did great on your first presentation.
Thank you.
We now are going to move into accessible housing, which I've been guaranteed is going to be very dynamic.
Yeah, we'll go with that. How you doing this afternoon, council? So Dr. Chima, you did not say the best for last. I'm still here. So just wanted to throw that out there quick. And then I think there's something on the agenda. Maybe the attorneys are last, but we don't know. So we'll see. Just wanted to go ahead and start. This is everybody's favorite topic, accessible housing. I mean, you don't have to look very far in the news. You don't have to look very far anywhere. And it comes up good, bad, but housing, housing, housing. So we're excited. It's an exciting time in the Housing Department of Planning and Development Services to sit here and say, you can always ask, like, how are things going? Are you busy? Yes, we can always say we're busy, but I would change that and say we're excited because we have a lot on our plate. We feel that we have a really bright future ahead of us. So just kind of want to dive into what we're looking at as far as the budget for 2022. So the housing program is committed to providing resourceful programs such as neighborhood revitalization, single-family rental rehab, rental assistance and education, and overall community outreach. These programs impacted over 7,900 people last year, including helping residents during the difficult times of COVID. Even during the pandemic, we're able to make progress towards our goal, our BHAG goal, of creating 1,000 new housing units. And we actually, in 2020, were able to rehab 95 houses and creating 151 new units. However, meeting today's challenges of affordable housing takes a comprehensive approach that involves single, multifamily, along with protecting and advancing the viability of the existing neighborhoods. So, to talk really quick about the attorneys are here, they're the last. So, to talk really quick about our BHAG, where we're at with our BHAG right now, that was a big goal. That was we were looking to do 1,000 units by 2022. And it was kind of one of those things where you take a look at, but it was a BHAG, right? We all know what a BHAG is. But today I can actually tell you right now, we have 719 new units under contract. Okay, so we feel very confident that with that BHAG and with some additional funding through these ARPA funds, that we're gonna meet or exceed that goal of creating 1,000 units by 2020. So that's kind of where we're at as far as overall a big scope where we're at for our housing programs. But I'd be remiss if I didn't take a little bit of time to talk to you guys about the 2026 Housing Action Plan. It emulates very closely to the One Sioux Falls logo, and I just want to go over the plan and what the plan actually consists of. We've been working together with multiple departments within our Planning and Development Service Department with administration, kind of coming up with what this looks like. We've got to wrap our heads around how we're going to tackle housing. And that's why we came up with this plan. So the very first thing is land. You'll see the pillar on the side there being land. Some of the things we want to do with land, we want to look at upzoning, right? We want to look at moving some homes. I'll be here later on tonight to talk to you guys about some homes that are going to be moved, okay? So we want to look at partnering with CCOG and doing some of that stuff. We want to look for, with land, we want to look for areas of redevelopment through our community. With workforce, we want to see if we can better utilize the quality of life investments to increase workforce. We're going to work on partnerships with the Home Builders Association, the American Association of General Contractors. Okay, so public-private partnerships, everybody's favorite one. We want to look at creating let's talk about a housing TIF. Okay, we got to look at that. Let's really examine that a little bit and see what that looks like. Okay, we also need to look at a housing fund, right? So we'll hear about the second reading tonight with some ARPA funds going into the housing fund. And then we also want to look at just creating some existing partnerships with our CDBG and home funds. The next thing we want to look at is our design and building standards. We're really taking a look at our 2021 codes, our building codes that we're adopting. And it's time for us to take a step back and look at other options, low impact development. We got to look at other ways. We got to look at just to do a whole code review. So we spent some time, even with the legislative summer study, talking about housing, talking about these, and we've been, I know Butch Warrington's been meeting with the Home Builders Association, so we're looking at that. The last one along that pillar is infrastructure. We're working very closely with Public Works and Engineering. We have a couple different sanitary sewer studies that are underway, looking for areas for future development. So that's kind of what the 2026 Housing Action Plan consists of. So getting into the meat here, so whether it's the home you grew up in or the first apartment you rented or the place you raised your family, the concept of a home has a special meaning to all of us. Safe, quality, affordable, and accessible housing serves as the foundation of a sustainable community, impacting everything we do from public safety, workforce, and economic development and quality of life. The 2022 budget invests just over $7 million in helping people. I'm going to repeat that one more time just because I think it's so important. The 2022 budget invests just over $7 million in helping people. The budget includes a commitment to long-term sustainability that will provide the city with flexible funding to apply onto strategic housing initiatives and connecting people with resources. The commitment of service and the connecting people with resources is what drives us. Continue to look for ways to help people more easily to navigate the system for assistance or to revitalize or rehabilitate their home is what we do. So to kind of go through our areas for scaling for growth, sustainability and flexibility, additional commitment of annual dollars, that's what we're talking in one-time contributions, that's the housing fund. Okay, so that's where I can sit here and say we're excited about. We're actually gonna have some money to start appropriating some dollars to tackling the housing needs. Connecting people, neighborhood revitalization. This is something it's my new title, Neighborhood Revitalization Manager. We're the city administration, along with the leadership of the planning and development team, we really feel so passionate about neighborhood revitalization. And we want to look at ways we can scale this. We want to coordinate code enforcement. We want to actually work with CCOG. We want to work with different entities on moving homes rather than demolishing homes. So that's the way we're going to connect with people and investing today for better tomorrow. All those projects you see there, the VCP, Veterans Community Project, Millard Acres, Brett Crossing, St. Paul and Walnut, all those projects right there that consist of about $3 million in city investment. That was our investment in those projects. Our return on those was $40 million. We put in 3, our return was $40 million. So there's a lot of number of units in there, so we feel very, very passionate about those projects we're working with. And I just want to touch on a few of these. The VCP project, they've been here several times talking to you guys. We're honored to be a part of that project. We've got involved with some land acquisition, and we're currently looking at utilizing some CDBG funds to pay for the infrastructure, the road on North Willow Avenue at the bottom there. Another one that we're really excited about, let's see here, is Millard Acres. This is Millard Acres is the project it's a partnership between us and Habitat for Humanity. It's up in Norton Acres. We're looking to create about 26 units up there, and it's the very first low-impact development pilot project between the city and Habitat. So we're excited about that one too. So I know I had you on the edge of your seats during that, so just to wrap it up, if you have any questions, I'm here.
Questions, council? Council Brecky?
The Millard Acres project, can you go into a little more detail on that? And are we going to have a briefing on that? I did ask our council's leadership to ask the health department to brief us on, on this project, because it was in the budget. And, and just, yeah, I was interested in it and wondered if we could have a briefing on this and just the whole neighborhood revitalization.
Sure. I mean, I would be happy to do that, but for now, I can just talk a little bit about the partnership between the city and Habitat for Millard Acres. We got involved with the land acquisition on that one. And then the partnership between Habitat and the city on the low impact development pilot program. That's a partnership between us and Public Works. We've been kind of looking for an area to actually have a pilot program for low impact development, and this one fit beautifully. So it just kind of works.
Is this something that we're just we kind of made up ourselves, or are we modeling it, the program after something we've seen successfully done somewhere else?
This one is something that it made a lot of sense. I know I wasn't in the role of housing when this thing first came about, but it was it was a partnership between us and Habitat, and I think the project, we'll see how it works, but I mean, there's foundations underway right now, and they're starting to pour some foundations, so it's kind of a test project for us. But if it works, I mean, this is the kind of area that we want to start focusing on.
I think it's very exciting. Thank you.
Yep.
Councilor Erickson?
Thank you. Thanks for the presentation. I mean, this is a hot button item that we all want to make sure that we're being successful. It's a nationwide issue that they're feeling the strain everywhere. And so whatever we can do to help along in that process, I know we've sat down and met many times, and I just really, truly believe that everything needs to be on the table. We have to get as creative as we can, identify the problem, and do things differently. It may challenge us each a little bit outside of our comfort box, comfort level, and we may even have to go to the legislature and ask for some changes, whether that's this or that, to make sure we can do some of these things. And I think we shouldn't be scared of that because we're trying to solve our own problems. Can you, I know this isn't part of your process, but where is the legislature on their housing?
That's
They were here 2 weeks ago, I believe, and so I'm just curious if we've heard, unfortunately, I haven't heard anything lately, and so I'm just curious if there's been anything wrapping up with that, or bills, or what will be coming out of that.
Sure.
And maybe it's not appropriate for today, but.
I don't know as if we've heard any final on that yet. I know Director Eckhoff and myself were in Rapid, and then we were at this one in Sioux Falls as well. And we haven't heard anything as what a wrap up is. But I'm glad you mentioned that, because if we have to go to the state legislature, that's one thing we've been talking about. If we need to make changes at that level, we'll make them. I think you're right. I think everything's on the table. So it'll be interesting to see what comes out of the legislative summer study on housing. We hope that maybe there'll be a state housing fund established as a result of that. But we're just excited from the stuff that we have going on too. But on the state level, we'll have to get involved.
Well, and to be honest, we can't sit around and wait. We just can't. We have to, and that's no disrespect to anyone else, but we've got to do what we can do right now. And anything else that comes after that is gravy, truly. We want to partner together. We want to make it make sense. So whatever we can do for that, I think is great. But again, all things should be on the table, and we really shouldn't be scared about that. It's just, we've done things the same way for years, and let's find a way we can do them differently. So
that's what we're excited about, the housing fund. We're really excited to start figuring out ways we can utilize that fund to help solve some of our issues. So.
And I know we're excited too about, getting our new committee up and going, and we'll probably bring you in as well as your department to find ways that we can make some adjustments and changes, whether it's public works or planning and zoning or what that looks like. So we'll definitely be in touch with that.
Sounds good.
Councilor Jensen.
Thank you, Mr. Chair. Could you go back to your housing action plan for 2026 that the administration, your department, this hits a lot of what we've been hearing from our constituents. A lot of us, including Councilor Sale and Councilor Erickson, as well as you and Director Eckhoff, we've been out listening to the community. We've had many outreach sessions, and each one of the housing problems that we have today is somewhere categorized in this chart, whether it be land, workforce, public initiatives, partnerships, design, building standards, and infrastructure. And it's all based around that outline circle, which is the economy. The biggest problem we have right now is we have one of the best economies anywhere. So that's a great part about it. And the workforce, we're always going to need more workforce. And if we can help craft great educational partnerships, and I know that in the budget, STI is in our budget, I think it's absolutely critical that we just keep focusing on that and hammering that home and letting these young people know you don't have to go into a whole lot of debt. In fact, you can use the Build Dakota Scholarship to go to STI, to go debt-free to school and walk away with a high-paying job at 50,000 plus. I mean, those are the high-paying jobs that Counselor Sale is talking about in some of the initiatives that we have going for the Sioux Falls for All. Those are the kind of things that I think is very, exciting about what you guys are working on. And we should really keep focusing on it. But what we've heard the most in this is A, workforce, but B, access to developable land. And that is all about the one that's right below it is infrastructure. So I know you will work with, everyone, including the council, to roll this out because this really is a comprehensive approach. If you look at what the state has talked about and all those, which you have, and I know you guys have been there, they are focusing on infrastructure and getting land developable. The other just comment, and sorry for not having a question for you, but I just wanted to appreciate this graphic because it really stems from a lot of work that we've done, is that, and Councilor Erickson is tagged for this, there's a lot of people that work in the city even that pick their head up off of their pillow in Brandon and they come into Sioux Falls to work. We have to focus this plan in a regional aspect, and I think the state of South Dakota would like that as well. And if we can, use our expertise to help some of these neighboring communities also thrive, I think that's going to be a really big thing. So, if you need more for moving this forward from infrastructure to workforce funding, we're here for you. And we're ready to go, so we appreciate it and keep up the strong work, okay?
Thank you. Councilor Brecky?
Just one more question. In the neighborhood revitalization portion of the plan, of the overall planning, I love the idea, the holistic approach. I love the code, taking the holistic approach to code enforcement. That's just, an expansion of the concepts that were, began under Projects Nice and Keep, trying to do everything at once and doing it oftentimes in a helpful way as opposed to a strong arm way, Have you discussed at all, the possibility of programming involving public-private partnerships that can be joined together to assist in helping revitalizing those neighborhoods in need? For example, such things as like adopt a neighborhood program where you get businesses to actually engage with the government in order to help, with private money. And again, taking a holistic approach in those things that aren't just about code enforcement, but it's just about, a need and meeting unmet need. Have you had those discussions and as part of that?
With the neighborhood revitalization new team that's been put together, everything's on the table. So we have not had a specific conversation about that, but we're gonna start tackling a lot of issues in neighborhoods, as a result of housing, as a result of safety, as a result of planning, all that, economic development, everything. So that'll be something that'll be on the table for sure. We've had some of those not directly related to those conversations, but I can assure you that going forward, we'll be looking at everything.
I would love to have a conversation with you about that. I've talked to several large businesses. Some of them are kind of sort of already doing it, where they're allowing their employees to get off work to go help fix up properties in neighborhoods. And there's been, everyone that I've talked to of these large entities are very interested and showing a willingness and interest in participating in something like that if the city were to be the orchestrator of it or the administrator of it.
Another successful thing we've had as a result of this is the neighborhood grant program. That thanks to the council, they put some money back into our budget to revive that program a little bit. So neighborhoods are actually able to apply for grants for special projects that are taking place in these neighborhoods. So we've seen those projects already producing dividends already on the back end. So it's a positive thing for the associations as well.
Thank you. Thank you for your presentation.
Councilor Erickson?
I'll be brief. Just piggybacking off of what Councilor Brecky was talking about. A lot of churches do just that. I don't think they partner necessarily with the city, but I know my church, for example, Central Church, we planted a preschool downtown in the core neighborhood, and it's free. It's free for the folks that can't afford it. They give back in the community. They rake leaves. They put new roofs on. They paint, and they really use the gifts of those folks within our church. It's awesome, and I mean, they take an offering, and the money goes back into the neighborhoods. It's just something our church has felt called to do, and it's something our guests, as well as all the attendees, we've got our own crew that preach down there and whatever, not to get on the preachy soapbox, but it's an awesome opportunity for others to engage in that as well. And we've seen great success from making sure that there's education and daycare and helping folks that are in those neighborhoods that maybe just need a little hand up. And it's a great opportunity for others that have skills to get involved, whether it's STI to say, hey, you know what, we need these welders to come in and do whatever and give back versus doing it in the classroom. And so there's a lot of great opportunity. It's a matter of who wants to own it, and oftentimes it's, you know, having those churches or the schools or whatever that may be own those programs, and everyone wins truly with that. So it's a great concept and would love to see it expanded further, but really the churches are doing a phenomenal job in some of these neighborhoods.
Councilors, other questions, comments? I've got just a few, and I realize you've only had a short period of time to really be the guy that's responsible for this, which means that you have a heavy burden to do that. And I will just say the council has probably been distracted by other issues that have come to the forefront in the last few months that have taken up a lot of our time. But once that's resolved in the next few weeks, the spotlight will be back on our housing situation, which has been identified by several of us, probably the number one issue we have in Sioux Falls. So as I look at your budget here and I see some money has moved around from the different programs back and forth, but you've only asked for a $649,000 increase in your budget. And frankly, I'm disappointed that that's not enough. Because my personal opinion is if we don't shoot for the moon on this, we'll be back here next year and we'll be talking about the same problems. So I'm gonna ask if you could go back, revise your numbers, increase the hell out of them, and then come back, because the council will support putting money into the housing going forward. You've done a great job in your presentation, and I don't have any questions. I just thought I'd make a statement. Thank you very much.
And last thing, I'd be remiss if I didn't thank the finance team, Sean's team of Amber and Tim. They've been a huge help with this, and they make the process seamless. So thanks to the finance team.
Thank you.
Thank you.
Our last, I don't know if he's asked to be last, but he's last on the program today, but he's certainly not last in your hearts. Number 5 on the program. Number 1 in your heart, the city attorney.
Good afternoon, Council. Stacy Koistra, City Attorney. Councilor Sale, your last sentiment there, that apply to the City Attorney's office as well on the funding piece, or not?
Tell us what you need.
All right, thank you. Okay. So good afternoon again, Stacy Koistra, and I am privileged and proud to represent the City Attorney's office in our budget request for 2022, and I'm going to ask, just keep going. There it is. All right. I'm proud to represent the 15 members of the City Attorney's office. I can tell you that this office is populated with amazing professionals who are also amazing people. And we take very seriously our mission to support every department within the city, as well as the city council and their staff. And I say to my team upon occasion that you know, the wheels of progress can grind to a halt very quickly if our office is not doing its job. I think from time to time, some people would say we grind it to a halt anyway, but that's the nature of the legal business, I guess. So with that, you know, our budget for 2022 is in many respects largely similar to the budgets I've presented in the past. Our budget, I like to joke, is personnel and office supplies. So as I mentioned, we have 15 personnel presently. We have 9 attorneys and 6 staff. And we are spread throughout the various departments. And so the only real change that we have this year, and without getting too deep into the weeds, I can tell you, as you can see, that we are very heavy on personnel and very light on operating. And our request this year is to add another full-time city attorney, assistant city attorney. The basis behind that is really the growth of the city. And the area in which we are requesting that, and I am requesting that, is to add an ADA attorney. Somebody who would be dedicated full-time to the support of our disabled community, and someone who would focus on that exclusively, as well as converting our HRC position, which currently they're blended, in one attorney, and allow that attorney as well to focus fully on the equity and inclusion components of the city. Now, with both of those roles, I would encourage you to think about them in really 2 ways. There's kind of the defensive and the offensive component of that, and I only mean that in a positive way. And I'll use the HRC as an example, as the office to which the public can go if they believe that their civil rights have been violated, that they can raise discrimination complaints that violate, frankly, federal law, as well as our state law and city ordinances. But then that role also has a component where it's an engagement with the community on education and support with the increasing diversity within our community. The same, in effect, applies with what would be an ADA attorney. The American with Disabilities Act expects compliance with federal law on how we care for the disabled members of our community. But then also we have a lot of opportunity for growth within the community when it comes to, again, engaging with that community. So that's the long and short of my office and our request, and I really appreciate your consideration and welcome your questions.
Councilors, questions? Councilor Erickson?
I'm not going to let you get off without any questions.
I didn't expect to.
That's just not fair. That's not fair. And I understand. I mean, you are bobbing and weaving and dealing with all issues that come up from a legal standpoint. So I get that. Sometimes we need to outsource for additional expertise. From our budget component, how much of that do we outsource in that?
Well, it's a good question. I'll answer in 2 ways. So we are generally funded at about $55,000 for outside counsel within the city attorney's office. Sam, correct me if I'm wrong. Nope, I guess I'm right. So now the reality is that the departments also from time to time need outside counsel. And so there are separate budgets. Public Works is one that leaps to mind because they have separate budget, and there are times that we need, you know, pick your specific area or in the event of a conflict or something.
Right.
So that's what we're budgeted for. How often we use it varies on the year, really, because of course the legal component is really hard to predict. And
right.
So I think historically, you know, I've left it unchanged each year that I've been here, and it's a number that's worked for us. And so I see no reason to ask for an increase in that, yeah. But I'd also be leery to reduce that as well, just right. Because of the unknown.
No, and I'm not advocating for that one way or another. I just know that there are times that, you know, it's a complicated TIF or it's bond counsel or whatever it is. We have to look at that. And I don't know if it would be appropriate from your office or where it would come from, but I would be curious the breakdown from each department as far as what's outsourced as we add additional staff. And I get the need to add an additional staff member to focus on those areas. But if adding additional staff, if that would level out any of that additional outside counsel in those departments. But if there's a way to get, again, I don't know if that needs to come from finance or the attorney's office as far as what each department outsources for that, I would be interested in that information.
Oh, that's a great point and a great request. What I would tell you is, and we're of course unique in the state because we're the size of Sioux Falls, and so we have 9 attorneys, which is significantly more than everyone else. I think Rapid City has 5, maybe. But even with that and the volume that we deal with, we are, as a matter of practice, general practitioners. And so, you know, touching on your point about specialty work, you know, we do what we can. We've got, again, fantastic attorneys who, many of whom are early to mid-career, which is an absolute win for the city. And as that experience has grown over the years, and they can handle increasingly specific things, but there are a host of considerations that go into outside counsel.
No, and I get that, and it's not to critique, it's just really information type driven, just to see really where, you know, where, does it make sense to add 2 attorneys and have our own, whatever, our TIF expert? You know, I know we outsource a lot for TIFs, and so if that's something that we're looking at expanding and whatever, does it make sense to have that on staff? So it might benefit you in the end too. I mean, maybe we will want to beef that up. I don't know, but I certainly would be interested in that information.
Well, it's wise to keep an eye on because we are growing, and so you get to a point where that volume does exist in some of those areas. So we'll work on that.
Thank you.
Yes, ma'am.
Other questions? Councilor Kiley?
Thank you very much. And I am in full support of the addition of an assistant city attorney to manage ADA compliance, because that in itself is a huge undertaking. I mean, we have a good portion of our population. It was presented to me here just recently, the largest minority group in the city of Sioux Falls, as well as within other communities that rely heavily on the Americans with Disability Act, just so that they can do the things that the rest of us take for granted. So, and as the button would imply here, I am and continue to be a big supporter of individuals with disabilities, and the city should be viewed as a partner and an advocate rather than you know, a barrier or part of the problem that hinders individuals' ability to be contributing members of their community. So again, full support of that. Kudos to you for bringing that forward.
Well, I appreciate it, and as the council recalls, in May of this past year, Charlotte Swenis, our assistant city attorney, briefed the transition plan and how we're really focusing on not only identifying anything within the city that's maybe a challenge, but actually accomplishing, because no city in the nation is 100% compliant because of the scope and volume and complexities of it, but it doesn't mean we don't work toward that end. So, thank you.
Councilor Brecky?
I'll pass, yeah.
All right.
Grab.
Councilor Starr?
Yeah, I thought of something. One of the things, I guess, the cost that we pay for our liability insurance through the South Dakota Assurance Alliance, that's billed department by department, or how with our relationship with them when they cover that liability expense?
Actually, I'd probably refer that to the finance office to speak to. Of course, we work closely with them on the liability and the coverages, but the budget component I'm not as familiar with. So. Yeah, it's billed back to each of the departments.
Okay. And then when that answered what I needed. Thank you.
Seeing no other questions, I just have one. Could you clarify to me the multicultural center support? Is that just a pass-through through your department? Are you actively involved in the supervision or management of that?
It's a pass-through in our department. It's part of the HRC. There's a relationship there, but that is by and large, it's a product of an agreement that we have with the county for funding that, and so it goes through our office. But we don't, I approve it every month, but it's a pass-through.
Okay. Seeing no further questions, thank you very much. Job well done.
Thank you.
That concludes our department budget presentations. We move on to public comment. If anybody wants to speak on any of the budget things that were brought forward today, you have 5 minutes.
Sierra Riverside, Sioux Falls. So let's start with the police department here. I think, and I'm going to say it again for the last time, I think that, how are we going to say this? Chief Doom, in my opinion, is way better than Chief Barnes. We don't have to push anything down his throat in the budget like we had to do with those body cameras behind closed doors. I talked to that police department from officers to sergeants to lieutenants on up, and I'm going to tell you they're about 50-50 on accreditation. Do I believe in accreditation? Absolutely. I think that this police department needs to be accredited. Absolutely. Should we halt that accreditation for right now and not put it on the burden of the police and the budget? Absolutely. And why is because not everybody knows the police department like you and I know the police department. It takes a lot for that accreditation. Do they have issues internally? Absolutely. And if Chief Doom says no, then he's not telling you the truth. He will back me up and say, yes, not every police department is exactly 100% tip-top condition here. Do I believe that internal policies and everybody that's going to hold them accountable, do I believe that they will hold people accountable to those policies? Yes, because you know what? I had to deal with some policemen on the streets on internal policies, and they were dealt with. So I know from my perspective that they deal with the police officers. They go through those body cameras and they get those evidence. We have to build the community first before we can put it at accreditation. So we're going from 0 to 10 on that accreditation. We don't have enough policemen on the streets to begin with, especially in high crime areas. So he has to put enough police department, enough people on that police department force, enough numbers on that police department force, and then go out in that community and try to build up that community to trust the police department before we can do an accreditation. So I asked that the accreditation be on hold for that. I was on a crime scene in the alleyway of Pettigrew last week, and of course, you know, people get beat up there all the time, and you know, people act like they don't see or say nothing. And the guy was on the ground and he was full of blood. And I noticed when the fire department came that we had diversity on that fire department force. We had a black individual male from another state. There's a lot of people from other states coming to apply for that. For the fire department. I'm not understanding why we're not getting local people of diversity on that fire department force. I don't know how we can do that. The police department also struggling with diversity. We need a little bit more diversity on that police department force. You're never going to hear me say anything or any complaints about Chief Thurm like I did with Chief Burns. I think stuff will be dealt with. I think that the community will come together more. He's not a person to be just indoors behind four walls. He knows what it's like to reach his hand out of that office to the community. Chief Burns wasn't like that. I don't think we're at this point where we're going to have to shove an accreditation down his throat in a budget. I think if we give it time, that he will eventually try to work something out to do an accreditation. And I understand that some police officers say CRA costs us a lot of money. I hear it. Upper management to lower management. I'm not going to say if they're against or with accreditation because it's about 50-50. You have to look at it. If this becomes a public vote and we get petitions to do a public vote, will the citizens be okay with the amount of money to be accredited? Absolutely, yes. Yes, they will. There's pros and cons to that accreditation. Brings the community together more. It holds people accountable internally. I never had an issue, internal investigation going wrong with evidence and anything like that. They always treated me fairly when I had complaints internally. So I don't know about other people with their internal stuff on the police department force. But we have to work on trying to get that diversity in that police department. We have black officers. We have people from other countries in there, But we need to have more of our people in the state of South Dakota applying it instead of always from different other states like we do with that fire department. We got to try to pull in people locally, and I don't know how that's going to ever happen.
Any other public comment? Seeing none, this meeting is adjourned.